with shoulder replacement surgery, the recovery actually, in terms of pain relief, can be quite quick. The arthritic pain has actually gone away almost immediately after the surgery, and the surgical pain for patients oftentimes is improved within a week or two, to the point that most patients are off of any painkillers throughout that time frame. In terms of the activity, we do initiate physical therapy right away after the surgery, and patients meet with the physical therapist in the hospital before discharge. They begin a light program on gentle range of motion and other activities to prevent the shoulder from getting stiff. But ultimately, we do restrict activities and ask people not to do anything strenuous with the shoulder for the first 6 weeks after the recovery. Once 6 weeks hits, we do allow a light strengthening program and allow patients to get back to light activities around the house, activities of daily living, driving a car. Ultimately, though, it's not till 3 months before we lift restrictions and tell people that they can start progressing their activities as tolerated. Ultimately, with a shoulder replacement, most patients are pretty well recovered by 4 to 6 months and back to doing all their activities. It could be up to a full year before they regain their full optimum recovery from the procedure. But ultimately, most people are very satisfied with the result, even by 4 to 6 months after the procedure. In regards to lifetime restrictions, we do ask patients who have shoulder replacements to be somewhat careful about not overdoing it with the shoulder for the concern of wear or loosening of the components. And in this regard, basically there's no particular set guideline, but generally we recommend not overly strenuous activity or beating up on the shoulder, which for me in my practice generally recommends less than 25 pounds with that arm for lifetime usage.